Hello all, I'm Dr. Purabi Koch. I'm a non-invasive cardiologist at Kokilaben Dhirubhai Ambani Hospital, and I am here today to talk to you about cardiovascular diseases in women and bust some myths surrounding it. Now, according to the World Health Organization, a study that they did in the year 2010, heart disease is the number one cause of death among women, and in fact, more women die of heart disease every year than men. And in spite of the increased awareness, women are yet to recognize heart disease as the number one killer. Now, let us just try and understand why this is the case and what is the difference between heart diseases in men and women. Now, the very first I would say would be the risk factors. Now, apart from the common risk factors of heart disease like diabetes or blood pressures, high cholesterol or obesity, there are some risk factors which are exclusive to women, like I would say the first being pregnancy. Now, acute myocardial infarction is rare in the childbearing age, but pregnancy increases this risk by 3 to 4 times more. The second I would say would be menopause. Because of the decreased estrogen levels, women become more susceptible to heart disease. The third would be emotional stress or depression, which is a known risk factor of heart disease and is more common in women. The second difference between men and women would be in the manifestation of the disease. Now, apart from the common chest pain, which is a symptom of heart disease, women sometimes present with vague symptoms like, a pain in the neck, in the jaw, or maybe in the arms. They may present with nausea, vomiting, indigestion, or maybe giddiness or dizziness, or they may present with, unusual fatigue. Now, the third difference between men and women when it comes to heart disease, and I would say the most important, would be in the treatment seeking behavior. Now, according to the World Health Organization, again a study that they did in the year 2017, women not only screen less for heart disease, they are also the ones who even opt for treatment less when they are diagnosed with any sort of a heart disease. Now, to understand the problem, we have to divide the women, especially in India, into two different categories. The first being women of the lower socioeconomic class, and the women in the higher socioeconomic class. Now, if we talk about the women in the lower socioeconomic class, I think the only time that they receive any sort of medical attention is either during pregnancy or in the immediate postpartum period. Now, when we talk about the women in the higher socioeconomic class, I think the concept of denial comes into play. Now, there is the health belief model. It postulates that people only seek medical attention once they perceive their problems to be significant. And I think women do not consider heart disease to be one of their problems. Now, of course, once they show symptoms, they do seek medical attention, but that happens in an older age. And if we have to deal with heart disease, we have to think about preventive intervention, and this has to target the younger age group. And I would say early detection is the key, and here I cannot stress more on the importance of regular health checkup, especially after the age of 40, to diagnose any sort of heart disease, if at all there is. And women in fact spend more on a spa than they spend on their annual health checkups. And here I would like to conclude by saying that it is a ground reality that heart disease is a killer for women, and there has to be a change in the way of perceiving this and with the treatment seeking behavior. Thank you so much.